As physios, we're also trained to work with the cardiothoracic region, so that involves your heart and your lungs. So in a hospital setting, our job would be to clear people's phlegm and sputum or build up in their lungs. We would also work on reinflating the lungs after any kind of injury or trauma or even surgery. So these are a few exercises that I would recommend in the practice and for people to do at home for specific lung related reasons. So the first exercise we would do would be involving balloons. So balloons are a great tool to get the lungs inflated and to open up any space. So if you've had like a collapsed lung or you're not using the full capacity of your lower lungs, this is a really good way to do that. So all you're gonna do is pop it in your mouth, take a deep breath in, really low to your stomach, and then try to push and blow that balloon out as much as you can. So you got yours? Okay, let's compare. All right, ready? Deep breath in. This one's fine.
Oh,
okay. Okay, so as you take the deep breath in, it will help to get air into the lower lobes. And then as you blow out into the balloon, it's creating a positive pressure. So you need enough pressure to actually inflate the balloon. And this pressure will push back on your lungs and re-inflate some of the alveoli or the air sacs in your lungs. And that will push them open and help to clear any kind of phlegm that's built up, but also getting some lung movement back in, okay? There we go. So in terms of sets and reps, I usually recommend doing 2 inflations of the balloon, okay? And then taking a breathing rest. So just resting, breathing, just normal. Again, focusing on slow, deep breaths. At any time during any of these exercises, if you do feel lightheaded or dizzy or out of breath, you just stop straight away. The next technique that we use is called percussions and vibrations. So this is used more to help clear up any buildup of phlegm that might be in the lungs, and it's a good one you can do at home as well. So if you come into the practice, the technique we use is cupped hands, and we're going to find which section of the lung has the buildup, and we're just going to focus on percussing just like that, okay? It should create this very hollow sound, okay? And the idea is these vibrations are going to penetrate into the lung and kind of shake and loosen up the buildup on the side, and it will make it easier to bring up later. You can do it at home as well, so with yourself, creating cups, and you're just gonna on the chest and then slowly up and down, just to loosen up everything, okay? This is a good one to do in the shower, because in the shower, nice hot steam, as you breathe in, that steam will help to loosen up the lungs as well, so it'll help you clear up some more stuff. The next technique that we use is very specific to a specific body part, okay? So I've got a stethoscope. We'll use this in the hospital to listen to the lungs to see where there's a lack of airflow or where there might be a build up of any kind of phlegm or sputum or gunk, okay? So the idea of this is we want gravity to help us with moving air to a specific lobe of the lung, or to help to position the lung so that gravity will pull any kind of build up of gunk in there, okay? So let's say Amelia here has a build up of gunk in her left lower lobe right here, and there's a little bit of crackles there, so there might be like a buildup of phlegm, a little bit of bubbling. So what we're going to do is we're going to get her to lie with this side highest to the ceiling. So let's get you lying on your side facing this curtain, please. Yep, cool. So in this position, this part of her lung is the highest point, so gravity is going to force all of the buildup of gunk down. At the same time, as you take deep breaths in, it's going to go up and inflate this area. So it's a double whammy. We call this positioning, okay? So if you take a deep breath in, try to inflate right here. Good, and then breathing out. Perfect. So this is a good way to help increase air volume to specific lobes of the lung. So it's getting into the colder seasons. So a lot of people are starting to get upper respiratory tract infections, colds, flus, viruses, all that kind of stuff. This will lead to a buildup of phlegm in their lungs. So this is a beautiful technique that we use in hospitals, and I prescribe it to patients with these issues. That helps to move all the phlegm that's built up in their lungs and to expel it out, or they can swallow it down. So we call this technique the huff. The huff is similar to a cough, but you keep your throat open, okay? So it's a little bit more efficient than doing coughs and doing like hacks to try to get phlegm up, and let's go through it right now. So there are different volumes to doing a huff, okay? There's a low volume huff, a medium volume huff, and a high volume huff. So low volume huff is just to get the air down underneath all that build up and to move it closer to the surface here. So the best way we teach it is to think about fogging up a mirror. So you're gonna take a deep breath in, slow and low, and then so as you breathe out and breathe in, it's going to move all of the phlegm out here closer to the airways. Next one is a mid-volume huff. So a little bit more force behind it. This is to get the phlegm from here up to the throat. So again, deep breath in and a little bit more force behind it, and that's to push it up here. So if you do have a buildup of phlegm or whatnot, you actually feel and hear the gargling of the phlegm building up in their throat. And this will lead to the next session. So this is the high volume huff. So at the end, very big deep breath in with all the force similar to a cough. You're going to keep your throat open and force it out. So deep breath in, throat open, and this will force all of the phlegm that's built up. So I personally do this every morning as I'm brushing my teeth just to clear up my lungs. It works really well when I'm sick. So I've been sick a couple months ago and it just cleared up all the phlegm. Make sure you have something nearby. So in the practice, you'll use tissue to catch all the phlegm. When I was working in hospitals, they would use cups because there'd be that much phlegm, it just built up in the cup. It's kind of gross. But at home, in the shower would be a great place because the steam will actually help to loosen up the phlegm to make it flow easier. Otherwise, into the sink is perfectly fine. In terms of sets and reps, you want to do about 2 low volume huffs, take a resting break, 2 mid volume huffs, take a rest, and then 2 high volume huffs, and then take a rest. So when you take a rest, you just slow, relaxed breathing. Bring your head back if you're a bit lightheaded or dizzy, but if you do get too breathless or lightheaded, just stop the technique straight away. Fuck. Nasty, nasty. Okay.